If you're over 60, you've probably heard the same advice again and again. Just keep walking. Walking is good. But today, I want to challenge that idea with something surprising, simple, and surgeon-approved. The title of my talk is Over 60? This one chair exercise is better than walking. Yes, better than walking. And it can be done safely, at home, and sitting on a chair. As we age, joint pain, balance issues, and fatigue can make walking difficult or even risky. But what if there was one powerful chair-based exercise that improves strength, circulation, balance, and mobility without stressing your knees or hips? Walking has long been considered the gold standard of exercise, especially for older adults. Doctors recommend it, fitness experts praise it, and many people over 60 rely on it as their primary or only form of physical activity. While walking is certainly beneficial, the reality is that after age 60, walking alone is often not enough to maintain full-body strength, mobility, and long-term independence. As we age, our bodies go through natural changes. Muscle mass begins to decline, a process known as sarcopenia. After the age of 60, adults can lose up to 1 to 2% of muscle mass per year if they are not actively strengthening their muscles. Walking, although helpful for cardiovascular health, is a low-resistance activity. It does not sufficiently challenge major muscle groups such as the thighs, hips, glutes, and core, the very muscles responsible for standing up, sitting down, climbing stairs, and preventing falls. Another concern is joint stress. Many adults over 60 experience knee pain, hip stiffness, lower back discomfort, or arthritis. Walking on hard surfaces for long periods can increase impact on these joints. For some, this leads to pain, inflammation, or even injury, causing them to walk less or stop altogether. When movement becomes painful, people naturally avoid it, which accelerates muscle weakness and reduces mobility even further. Balance is another critical factor. Walking forward in a straight line does very little to improve balance or stability. Yet balance is one of the most important physical abilities for older adults. Falls are a leading cause of injury after age 60. And walking alone does not adequately train the muscles and neural pathways needed to maintain stability when standing up, turning, or changing direction. Walking also has limitations when it comes to functional strength. Everyday life requires more than just moving forward. Getting out of a chair, reaching, bending, and maintaining posture all require coordinated muscle engagement. Walking does not effectively train these functional movements, which means someone can walk daily, yet still struggle with basic activities like rising from a seated position. Finally, consistency is a challenge. Weather, safety concerns, fatigue, and physical discomfort can all interfere with regular walking. Missed days turn into missed weeks, and progress stalls. This is why many surgeons and physical specialists now emphasize safe, low-impact, strength-based movement, especially exercises that can be done while seated. In summary, walking is helpful, but it is incomplete as a sole exercise after age 60. It lacks sufficient muscle strengthening, places stress on vulnerable joints, offers limited balance training, and does not fully support the functional movements needed for independence. That is why alternatives, such as targeted chair exercises, are increasingly recommended to fill these critical gaps and support healthy aging. One of the biggest advantages of this surgeon-approved chair exercise is that it activates more muscles at the same time, without placing stress on vulnerable joints. After age 60, the goal of exercise is no longer intensity or speed, but efficiency, safety, and functional strength. This is exactly where chair-based movement outperforms walking. When you walk, your body moves in a repetitive, forward motion that mainly engages the calves and a small portion of the thighs. While this helps circulation, many important muscles remain underused. In contrast, a well-designed chair exercise engages the legs, hips, glutes, core, and upper body simultaneously, creating a full-body workout while you remain seated and supported. One of the key reasons this exercise is safer is stability. The chair provides a solid base, reducing the risk of falls, a major concern for adults over 60. Because you are seated, your body does not need to constantly fight gravity to maintain balance. This allows you to focus on controlled, purposeful muscle engagement, which is far more effective for building strength than uncontrolled movement. Another important factor is joint protection. Many older adults struggle with arthritis, joint stiffness, or previous injuries. Chair exercises eliminate impact on the knees, hips, ankles, and spine. Instead of pounding joints with each step, muscles are activated through slow, deliberate movements, which improves strength while minimizing inflammation and pain. This makes it possible to exercise more consistently, even on days when walking would feel uncomfortable. This chair exercise also strengthens the core, an area walking largely ignores. The core muscles, abdominals, lower back, and pelvic muscles are essential for posture, stability, and everyday movements such as standing up or reaching. By engaging the core while seated, the body learns to stabilize itself safely, which translates into better balance and confidence when standing or walking. Additionally, this exercise improves neuromuscular coordination. As we age, the connection between the brain and muscles weakens, leading to slower reactions and reduced control. Chair exercises that involve lifting, extending, or pressing movements retrain these connections. Over time, this improves muscle responsiveness, helping prevent slips, missteps, and falls. Perhaps most importantly, this type of exercise is accessible. It can be done by people at different fitness levels, including those who cannot walk long distances or who use mobility aids. The resistance can be adjusted simply by changing speed, range of motion, or repetitions. No equipment required. In short, this one chair exercise works because it delivers maximum muscle activation with minimum risk. It strengthens the body where it matters most, protects the joints, improves coordination, and builds confidence, all while keeping you safely supported. That combination is why many surgeons now recommend chair-based exercises as a smarter alternative to walking for over 60. One of the most powerful reasons surgeons and health professionals recommend this chair exercise for adults over 60 is its combined impact on joint health, balance, and circulation, 3 areas that strongly determine quality of life as we age. While walking supports some aspects of health, it does not address all 3 effectively or safely, especially for those with existing limitations. Let's begin with joint health. As we grow older, the cartilage that cushions our joints naturally thins, and conditions such as arthritis, stiffness, and inflammation become more common. Walking, particularly on hard or uneven surfaces, places repetitive stress on the knees, hips, ankles, and lower back. Over time, this impact can worsen pain and limit mobility. In contrast, chair-based exercises allow joints to move through a controlled range of motion without bearing full body weight. This gentle movement helps lubricate the joints, reduce stiffness, and maintain flexibility without triggering pain or swelling. Because the joints feel safer and more comfortable, people are far more likely to stay consistent with their exercise routine. Next is balance, one of the most critical yet overlooked aspects of fitness after age 60. Poor balance is a leading contributor to falls, which can result in serious injuries and long recovery times. Walking in a straight line does little to strengthen the stabilizing muscles responsible for balance, particularly those in the hips and core. Chair exercises, however, intentionally engage these muscles. By lifting legs, extending arms, or maintaining posture while seated, the body learns to stabilize itself in a safe environment. Over time, this improves muscle coordination and body awareness, which directly transfers to better balance when standing, turning, or transitioning from sitting to standing. The chair also acts as a confidence-building tool. Many older adults limit movement not because they are weak, but because they fear falling. When the fear is removed, the body can move more freely. This confidence leads to stronger muscles, quicker reactions, and improved stability in daily life. Now consider circulation, a vital component of overall health. Reduced circulation can lead to swollen legs, cold extremities, fatigue, and slower healing. Walking does help circulation, but it is not the only or best option. Chair exercises stimulate circulation by repeatedly contracting and relaxing large muscle groups in the legs and arms. These muscle contractions act like pumps, helping blood flow more efficiently back to the heart. This can reduce swelling in the lower legs, improve oxygen delivery to tissues, and increase energy levels. Improved circulation also supports heart health and brain function. Better blood flow means more oxygen to the brain, which can improve focus, memory, and mood. Many people report feeling more alert and energized after chair-based exercise than after walking short distances. In summary, this one chair exercise delivers a unique combination of benefits. It protects and nourishes the joints, strengthens balance in a safe and controlled way, and boosts circulation throughout the body. Together, these improvements help adults over 60 move with greater ease, confidence, and independence, making this exercise not just an alternative to walking, but in many cases, a smarter and safer choice. When surgeons recommend an exercise, their priority is not trends or intensity. It is safety, recovery, and long-term function. For adults over 60, surgeons consistently emphasize movements that protect joints, reduce injury risk, and support everyday mobility. This is exactly why many surgeons now approve and encourage this simple chair-based exercise. From a surgical perspective, one of the greatest risks to older adults is joint overload. Years of wear and tear, combined with conditions like arthritis, osteoporosis, or previous surgeries, make the body less tolerant of impact. Walking, while natural, places repetitive stress on the knees, hips, spine, and ankles. For someone who has had joint replacement surgery, spinal issues, or chronic inflammation, this stress can delay healing or worsen symptoms. Chair exercises eliminate impact entirely, allowing muscles to strengthen without compressing or damaging the joints. Another reason surgeons support this exercise is its role in injury prevention. Falls are one of the leading causes of hospital admissions among adults over 60. Surgeons see firsthand the consequences: hip fractures, spinal injuries, and long recovery periods that can permanently reduce independence. Chair exercises improve muscle strength, coordination, and balance in a controlled setting, significantly lowering the risk of falls before they happen. Preventing injury is always better than treating it surgically. Surgeons also focus heavily on functional movement, the ability to perform daily tasks safely. Sitting down, standing up, reaching, and maintaining posture all require strong legs, hips, and core muscles. Chair-based exercises directly train these exact movements. In fact, many post-surgical rehabilitation programs begin with seated exercises because they closely mirror real-life actions while keeping patients safe. What starts as rehabilitation often becomes long-term prevention. Another critical factor is compliance. Surgeons know that the best exercise is the one a patient will actually do. Walking routines are often abandoned due to pain, weather, fatigue, or fear of falling. Chair exercises remove these barriers. They can be done indoors at any time and adjusted to match the individual's strength level. This leads to better consistency, which is essential for maintaining muscle mass and mobility as we age. From a medical standpoint, chair exercises also support circulation and recovery. Improved blood flow helps deliver nutrients to tissues, reduces stiffness, and speeds healing after injury or surgery. Surgeons frequently recommend seated movement for patients recovering from procedures because it keeps the body active without risking complications. Finally, surgeons appreciate the low-risk, high-reward nature of this exercise. It requires no equipment, no special training, and no gym membership. The risk of strain or eye injury is minimal, yet the benefits, stronger muscles, better balance, healthier joints, and improved confidence, are significant. In summary, surgeons approve this chair exercise because it aligns perfectly with medical priorities for older adults. Protect the joints, prevent injuries, strengthen functional movement, and support long-term independence. It is not just safe, it is smart, effective, and designed for the realities of aging bodies. One of the most powerful advantages of this surgeon-approved chair exercise is how easy it is to start. There is no complicated routine, no special equipment, and no need to travel anywhere. This simplicity is exactly why it works so well for adults over 60. It removes the biggest barriers to staying active and replaces them with a routine that fits seamlessly into everyday life. To begin, all you need is a stable chair. Choose one with a firm seat and no wheels, ideally a dining chair or sturdy armchair. Place it on a flat surface where your feet can rest comfortably on the floor. This setup immediately provides safety and support, allowing you to focus on movement rather than balance or fear of falling. Start slowly. The goal is not speed or intensity, but controlled, intentional movement. Sit tall with your back straight, shoulders relaxed and core gently engaged. From here, simple actions such as lifting one leg, extending both legs, gently pressing your feet into the floor, or raising and lowering your arms can activate major muscle groups. Even small movements, when done correctly, create meaningful strength gains over time. Consistency matters more than duration. Begin with just 5 to 10 minutes a day. This is enough to stimulate muscles, improve circulation, and reduce stiffness. As your confidence and strength grow, you can gradually increase the time or repetitions. Many surgeons and physical specialists recommend short, frequent sessions rather than long, exhausting workouts. This approach reduces soreness and lowers the risk of injury while keeping the body regularly engaged. One of the greatest benefits of chair exercises is flexibility and timing. You can do them in the morning to loosen stiff joints, during the day to boost energy, or in the evening to reduce tension. They can even be broken into small sessions, 2 or 3 minutes at a time, making it easier to stay active even on low-energy days. Listening to your body is essential. Mild muscle effort is good, sharp pain is not. Move within a comfortable range and breathe steadily throughout each movement. If you have medical conditions or are recovering from surgery, surgeons advise focusing on slow, smooth motions and stopping if discomfort arises. The chair is there to support you, not to push you beyond your limits. Another key to success is making it part of your routine. Tie your chair exercise to a daily habit, after breakfast, while watching television, or before bedtime. When exercise becomes a natural part of your day rather than a separate task, consistency happens effortlessly. Most importantly, remember that progress does not come from doing more. It comes from doing it regularly. This single chair exercise is designed to meet you where you are today and grow with you over time. By starting now, in your own home, at your own pace, you take an immediate step towards stronger muscles, healthier joints, better balance, and greater independence.